Hello and welcome to Making It Manufacturing Spotlight Series. We are live here at DCAT in New York. I am joined by CCO Frank Sorce of UPM Pharmaceuticals. Frank, how are you today?
I'm well, Harry. Good to see you.
Good to see you as well. How's the last few days been?
Hectic, to say the least, but I think productive.
Okay.
Yeah.
You got your black tux all ready for?
I do.
Tonight?
It's right over there, and I'm ready to go tonight.
Amazing.
Yes.
Frank, for the listeners, could you give us an outlook on where UPM are positioned in the CDMO market?
Sure. I would say mid-size CDMO.
Yeah.
We've evolved from, a small formulation development, early clinical trial material manufacturing CDMO.
Mm-hmm.
Now we're full service, one-stop shop under one roof.
Mm-hmm.
We do, half a kilo up to hundreds of kilos of manufacturing from, just beyond proof of concept to commercialization. So I think we sit right kind of in the middle. We're not Patheon, we're not Catalent.
No.
We're not, multiple sites, but a good sized footprint in the market for sure.
And you mentioned a few competitors like Patheon and Catalent. It's quite a competitive market, and there's no point saying we're like a Catalent. We've got the numbers and the facilities. Yeah. So how do you navigate around that market?
Well, because we've all been in the industry a long time,
mm-hmm.
we know success stories and we know failures.
Yeah.
At the big players.
Yeah.
And a key thing is identifying who you want to work with, who makes sense
mm-hmm.
for your organization. And smaller players, maybe with an orphan designation or, a smaller clinical bio company with their first molecule, they're going to get lost in a broom closet at a Catalent or Patheon,
Yeah.
And, they'll talk a good game and,
Yeah.
they'll be sincere, but when push comes to shove, they'll move you around in the schedule.
Yeah.
And, we realize that. And we realize that's a differentiating factor to use UPM is your product is just as important as a big pharma client.
Yeah.
Because your dollar goes as far as their dollar does. So, we want you to trust us in believing that.
Yeah.
And we've always gone by the premises, if I move you out, number one, you're going to be upset.
Yeah.
And number two, we don't make money on that batch either.
Yeah.
So, it's a business. So, you want to be profitable, but you want to support your clients and make sure that you meet their needs when they need those needs met.
So do you feel like you're in, you mentioned you're a mid-sized CDMO, you're in that sweet spot where your clients, you're able to have that kind of meaningful and trusting relationship? Yes.
Yeah, I do. We're family owned, and I know, we may talk about that in the conversation, but, we shake your hand and tell you we're going to do something. We're going to do it. We're going to follow through.
Yeah.
We have flexibility that maybe some of these bigger places don't.
Yeah.
And even organizations that have multiple sites, they may have to move your program around. You may get manufactured here, but you may get packaged there, or you may get testing someplace else. And you've got to deal with that communication within their network of facilities. In our building, you get manufactured on the 4th floor, you get tested on the 3rd floor, you go to packaging, and you go to the warehouse, and you go out in the loading dock.
Yeah.
So that you just feel a little bit more comfortable that you're not tracking things all over the world or all over the country, whatever the case might be.
So you mentioned earlier that you're a family-owned business and commercially experienced. How does that shape the way you work with clients?
Yeah, so the family ownership aspect of it, we always see as fast decisions,
mm-hmm.
flexibility, and, as I said before, trust,
mm-hmm.
And empowerment. We're not beholden to shareholders or Wall Street. We're beholden to ourselves to have an organization that is profitable, but you need the decision made, you need product, because things change all the time. We have clients that started out with, they thought 4 to 8 commercial batches a year. Product is a winner. It's doing really well. They've got additional indications. They're up to 50 batches. So we're like, okay, we'll handle that. We'll move our schedule around. We'll make sure we'll add a shift. We'll make sure that your production gets done on time.
Yeah.
And we control all that. I'm not part of the family, but I've been involved with them for a long time. And
Still part of the family then?
Yeah. I do feel that way. I've been here. I've been 1/3 of my career. I've been with UPM.
Amazing.
So, but that aspect of the ownership allows us to do those things that some other companies may not be able to do it.
Yeah, no, I completely understand. So you mentioned, I'm just going to dive into your journey a little bit. I want to hear more about you as well. You said you spent 1/3 of your career, at UPM. Could you just give us a little backstory on potentially how your journey to becoming CCO at UPM?
Sure can. So I hate to say this, but I'm in my 37th year in the pharmaceutical industry.
Right.
I came right out of school. I got lucky. I got a job at Merck Sharp and Dome, which at the time was America's most admired corporations. So, I was just thrilled and grateful to be part of that organization. Their training, their support, their family orientation, compensation, all the things you would want when you graduated from college. And I spent 7 years there. I moved on started in the service business just after my Merck experience in the contract sales business, where we would recruit, hire, train, and manage representatives on behalf of big pharma companies where they weren't sure if they wanted to take those employees on just yet. And they needed supplemental support. And I did that for 4 years, from a district manager, regional director, to a national sales director within that domain. And one of our clients was Reliant Pharmaceuticals.
Okay.
And they were a startup specialty pharma company buying products. They were sort of underappreciated by big pharma. And we built a pharmaceutical company like overnight. I mean, we hired 1,000 people in about 6 months and brought the products in, trained the people. I used to say we hired them in masses and we trained them in classes.
Yeah.
And got them out the door. And that company was purchased by Glaxo in the mid-2000s. So I took a little bit of time off, and that's when I first went into UPM, was in 2007. I knew the family, the Gregory family, because they owned King Pharmaceuticals, started King, and they were a competitor of Reliant. And I knew they were good people, and people loved to work for that company. And some of the people that were in that organization became millionaires just because they worked there, and the company went public, and they took care of everybody. So I joined as an individual contributor, as a business development head of marketing, and spent 12 years there. Executive director, VP of business development and marketing. And they had sort of a reorganization in 2019. I left the company, and last 4 years was with Synergy Biopharma Group, which is great organization, high-powered CMC, regulatory, medical writing consulting firm based in Boston. And about a little over a year ago, UPM called back and said, "Hey,
we're falling apart without you."
Well, yeah, I would like to believe that. But they were actually in the best shape they ever had been, and I hope I don't ruin that. But they said, listen, we're resurrecting our BD function.
Yeah.
We've commercialized a number of programs at the organization, and it's time to replenish the pipeline, if you will. And so I came back a year ago, and it's been a good year, a lot of activity, and so we're optimistic about the future.
But 35 years in the industry is very impressive. You don't look a day over 40, so don't worry,
Thank you.
Frank. You know, as everyone knows, it's not plain sailing in this industry. There's a lot of whirlwind. There's a lot of things out of your control that gets in the way. Is there anything you've learned, from a lesson point of view, where things haven't gone so well, and then you've been able to turn that around and kind of build those trusting relationships with your clients?
Yeah, I think, and I think a lot of people learn this over time, is you have to be patient.
Okay.
There's, as you said, there's natural vicissitudes in the economy, in the market, in the world. We have a war going on right now that, has pumped up oil 50% in the last month.
Yeah.
We had the financial crisis in 2008. And I think you keep working hard, you keep doing the right things, you be honest with people, you follow up, and you keep doing good work at the plant.
Yeah.
And you make it through. 2008 was a dark time in the business. There were layoffs. If there wasn't layoffs, there were salary reductions. Everybody was really pulling in their resources, pulling in their budgets, and we made it through.
Yeah.
Well, like I said, we kept working hard. We were out in the marketplace.
Yeah.
We kept spending on marketing and on business development, and we made it through. And we enhanced our client base over that period of time, where some other places closed.
Yeah.
One of the largest CDMOs at that time closed their doors overnight. And they were the biggest spenders in the marketplace from a marketing standpoint. They had 100 clients, and they just closed.
Surviving the hard times and thriving the good times.
Yeah, that's right.
It's finding the balance.
Yeah, that's right.
Frank, just, for our listeners, if we're sat here in 5 years' time, having the same conversation, is there anything in particular you want to see, with UPM and where it's going to?
Yeah, I think, could we expand on some of the modalities that we support?
Okay.
Right now we're solid oral for the most part, and semi-solid.
Yeah.
I would love us to look at other, maybe sterile fill finish, some of these large parts of the market now. When I started in the pharmaceutical industry, monoclonal antibodies were like this crazy concept.
Yeah.
There was one person in New Jersey who was advocating this, and everybody thought he was nuts. And so now you have antibody drug conjugates, you have cell and gene therapy, you have all these advanced kind of technologies, and I think we have the space to do it. And I think we have the foresight in the current management to be able to bring that technology in, and that there's talent out there, and I think for the right deal you can get them.
Yeah.
So I would like to see us expand that way into those other areas, because a lot of the market is going to that area.
It is. Yeah.
Yeah.
Okay. Brilliant. Frank, it's been an absolute pleasure speaking. Thank you so much for coming on.
Thank you, sir. I appreciate your time. It's been a pleasure.
Cheers.